viewers, welcome once again to my YouTube channel. And in succession to the videos what I have been taking up in general medicine, today's topic of the discussion is about, in very short, I'll be trying to discuss what is the condition of heart failure and what are the predisposing factors related to it. Apart from this, what are the types of heart failure? So, heart failure, in just one line definition, we can remember that heart failure, or it is also called as cardiac failure, is a condition in which the heart loses its tendency to pump sufficient blood to all the parts of the body. As you all might be very well aware, that heart is such an organ which is responsible for pumping of the blood. So when the heart fails its tendency, when the heart is incapable of pumping the blood to all the parts of the body, in a simple terms, it can be called as heart failure. In medical terminology, it is called as cardiac failure. When looking at the types, so actually it is through the from the right atrium to the right ventricle, and from the left atrium to the left ventricle, the heart pumps, the blood flows into it. So it can be, and it is from the ventricles the blood is pumped through the aorta into the rest of the body. So it can be, actually the heart failure can be of two types. It can be of it can be it is can be the either due to the left ventricular failure or due to the right ventricular failure, or it can arise because of both. So in other types, it can also be classified into three types, that it can be acute heart failure, it can be chronic heart failure, or it can be congestive heart failure. So there are these three types of heart failures. And when we look at the causes, so what are the causes what leads to heart failure? The first important cause, it is a coronary artery disease. So in many of the situations, it has been found that whenever there is any kind of a disease in the blood vessel that is supplying to the heart, that is a coronary arteries, the blood vessels of the heart what are supplying blood to the heart, whenever there is any kind of a disease, whenever there is any kind of a impaired blood supply to these coronary arteries, it can lead to heart failure. So the first important cause, it is a coronary artery disease. Next is the defective heart valves. So you all might be aware that it is the right ventricle, from the right atrium to the right ventricle, when the blood is forced, it is through the tricuspid valves, and when the blood is pumped from the left atrium to the left ventricle, it is through the bicuspid valve. So these, whenever there is any kind of a defect in the valves of the heart, it can also lead to heart failure. Apart from them, the third important cause which can be looked upon as, it is the arrhythmias. So whenever in conditions of arrhythmias, when abnormal heart rate is there, the rhythm of the heart is disturbed, this can also lead to heart failure. The next important cause of a heart failure, it is the cardiomyopathy. So whenever there is any kind of a muscle pathology in the heart, of the heart, that is a cardiomyopathic condition. And any kind of a pathology, any kind of uh, pathology what occurs into the muscles of the heart, it can also cause heart failure. Apart from them, the very important cause nowadays in the present scenario of heart failure is uncontrolled hypertension as well as congenital heart disease. So in conditions where there is an by birth certain kind of a defect is there in the heart, it can cause heart failure in the later situations. Apart from them, the very important causes can be looked upon as the diabetes in patients of hyperthyroidism, in patients of anemia, as well as in patients of lung disorders. So this has been found that this heart failure can be seen in all these secondary to all these systemic conditions of diabetes, hyperthyroidism, in patients of anemia, as well as in patients of lung disorders. Apart from them, whenever there is an inflammation of the cardiac muscles, that is, in medical terminology, it is referred to as the myocarditis, due to viral infections, drugs, or alcohol, it can lead to heart failure. Now, as I've already said, that heart failure can be divided into three important subtypes, that is an acute heart failure, chronic heart failure, and the last is the congestive heart failure. So when we look at acute, whenever the word acute is there, it is of a rapid or a sudden onset. So in conditions of acute heart failure, it refers to the sudden and rapid onset of signs and symptoms of abnormal heart function. However, the symptoms, they are going to last for a very short time. So students and viewers, do remember, whenever we call it anything as acute, it has to be of a very short duration. The time span of which it occurs, it is of a very short duration, and it lasts for a very short time, and the condition improves rapidly. So in conditions of acute heart failure, what is going to happen is there is a sudden and rapid onset of signs and symptoms, and these signs and symptoms, once they are present, they will for a shorter period of time they will occur, and the conditions will revert back to normal after certain time. So when we look at the signs and symptoms of acute heart failure, so when we look at how does the patient manifest the symptoms of acute heart failure, when the heart starts to fail, sudden fluid accumulates in the lung. Do remember, so whenever the heart is going to pump the blood through the aorta, in conditions of acute heart failure, there is fluid accumulation in the lungs, and that leads to pulmonary edema. So this pulmonary edema occurs, and the features what the patients are going to manifest, the features the patients what are going to the patients will tell of, it is that there is sudden and severe shortness of breath. So the patients are going to have difficulty in breathing, they'll be having shortness of breath. Apart from this, there can be palpitations. Palpitations, it is a medical terminology in which the patient becomes aware of the heartbeat. Normally, in a healthy individual, the patient is unaware as to how the heart is functioning, how the heart is beating. But in conditions of palpitations, what do we find is the patient becomes aware of his own heartbeat. So there can be palpitations, the patient may present with cough, and this cough can be of a pink with foamy mucus. So when the patient expectorates, when the patient coughs in acute heart failure, the cough what is there, it is pink and foamy mucus that is there, and ultimately it may lead to sudden death. Do remember, if it is in a case of acute heart failure and these all symptoms are there, if the symptoms are not controlled, it may lead to sudden death if not attended immediately. So this was all about acute heart failure. Now moving on to the chronic heart failure. So when we look at the chronic heart failure is the heart failure characterized by the symptoms that appear slowly over a period of time, and the condition becomes worse gradually. So the chronic heart failure is the heart failure that is characterized by symptoms that appear slowly over a period of time, and if not treated well, if not treated on time, the condition is going to become worse slowly and gradually. And what do the patients of this chronic heart failure mostly complain of? So signs and symptoms of chronic heart failure, it can be looked upon as the patients who are manifesting it, they may show fatigue, means they become tired even on a very mild exertion, or even on a very mild physical activity, they may get tired, they may get fatigued. Apart from them, the patient may manifest the symptoms of weakness. There is rapid and irregular heartbeat is there. There can be shortness of breathing, fluid retention, and weight gain. So since the heart is unable to pump the blood, there can be fluid retention in the body, and the patient may manifest of a sudden weight gain. Apart from them, there can be loss of appetite in chronic heart failure. The patient may sometimes exhibit nausea and vomiting, and certain kind of a chest pain is also elicited if it is in conjunction, if the heart failure is developed by a myocardial ischemia. So myocardial ischemia is a condition where there is an impaired blood supply to the muscles of the heart. So the patient may exhibit in chronic heart failure, the patient may exist a certain kind of a chest pain if the heart failure is developed by a myocardial ischemia. Apart from them, Last but not the least, in certain cases, in chronic heart failure, the patient may manifest of cough. Now, when we look at the third type, that is the congestive heart failure. So congestive heart failure, it's a general term, and in this general term, how do we define it? That the congestive heart failure, the heart failure that results in the accumulation of fluid in lungs and other tissues, it is called as congestive heart failure. And when the heart starts to fail suddenly, fluid accumulates in the lungs, and this causes pulmonary edema. So there is fluid retention in the lungs, and ultimately the patient is going to exhibit this pulmonary edema. It results in sudden shortness of breath. When the heart is not able to pump the blood through the aorta, the blood is going to remain in the heart. There is pooling of the blood in the heart, and ultimately it results in the dilatation of the chambers of the heart. So the ventricles of the heart, they are going to dilate, and there is accumulation of blood in the veins. That is, there is occurring of the vascular congestion. So in conditions of congestive heart failure, the vascular congestion is the most striking differentiating, distinguishing feature. So viewers and students, this was a very short discussion where I have tried my level best to give you a brief gist as to what is the condition of heart failure, what are the etiological age factors, that is the causes related to it, and the three types, that is the acute, the chronic heart failure, and the congestive heart failure. If you still have any queries or comments, you're most welcome to comment me in the comment section. And students and viewers who are new to my channel and they haven't subscribed yet, go do subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.